As we continue to recover from the COVID-19 pandemic, public health is in the bullseye at the State House.
That's right. Lawmakers are returning and could override the governor's veto of a bill that would limit the authority of counties and cities trying to put restrictions in place during health emergencies. Our Troy Washington joins us live this morning. And Troy, what are the details on this debate?
Good morning. Yeah, Governor Holcomb says that he vetoed the bill because he doesn't want to shift the power from public health officials who are experts when it comes to handling a pandemic to local officials when it comes to navigating things. Now, supporters of this bill, they say that it's deeper than that. They say it's about applying restrictions from local health departments that are more strict than restrictions from the state health department. It would not apply to health department orders issued against an individual business or resident over matters such as health code violations. The bill would also give city councils or county commissions hiring authority over local health officers. And it would also create a procedure allowing the public to appeal enforcement actions such as citations, fines, or in order to close a business to an elected county or city board. Right now, Marion County is one of the few places in Indiana with pandemic restrictions that are stronger than the state rules. The mayor of Indianapolis, Joe Hogsett, says he supports Holcomb's veto and was grateful that the governor had allowed local officials to adopt tougher regulations to help stop the COVID-19 spread. The mayor says, quote, "We have to be humble enough to admit we're not experts," Hogsett said. "We have to be humble enough to acknowledge that we need to listen to experts." Now, again, the overriding of this veto could happen. It only takes a majority vote here in Indiana. Reporting live, I'm Troy Washington, WRTV.
Troy, thank you so much. So let's stay at the State House on this Monday morning. This is not the first time that Governor Holcomb and his fellow Republicans in the legislature have clashed over pandemic-related restrictions. Our WRTV political insiders, we asked for their opinions about how this dispute, in their opinion, will play out later today.
Well, this may shock your viewers, me being a known Hoosier Democrat, but I'm actually siding with Governor Eric Holcomb here. and I am 100% behind the governor. I think this attempt to try to take away the power of the governor is just an absurd power grab by the Republican state legislatures and our General Assembly. I don't agree with it at all. I hope his veto is not overturned, but I'm concerned that it could very well be. But I'm definitely in support of Governor Eric Holcomb in this situation. Probably the one and only time I'll support Governor Eric Holcomb as a proud Hoosier Democrat. But he's got my support, and I hope this power grab fails.
It is symptomatic of sort of the dichotomy that Hoosiers have with the pandemic and the mask mandates and social distancing orders and the whole 9 yards. I think the more urban, more suburban settings, people are more likely fine with it. More rural settings, people aren't. And Indiana has a lot of rural lawmakers, at least for now. Redistricting that could possibly change. But I also think, too, that this legislation was torn on because while I support the governor and the mask mandate and social distancing, at the same time, you cannot have appointed officials just run rampant over elected officials, because appointed officials are not elected by the people. Your county commissioners or county councils are. And so that's why I'm kind of torn on this one, because at the same time, while I want people to be safe and secure and people to issue emergency orders, at the same time, there's got to be some sort of accountability from a county public health department. Now, this is why I wish Indiana the governor had what's called an amendatory veto, where he could sort of amend legislation and not have to veto the whole thing. And also, I think lawmakers have to have a 2/3 majority as well, as opposed to a simple majority, but that's a whole nother constitutional question for a whole nother time.